Hi, I'm Nikizin and I will be presenting information about shockwave therapy. So shockwave therapy is also known as extracorporeal shockwave therapy, which is in short form ESWT. It is a non-invasive treatment that uses high-energy acoustic waves to stimulate the healing of targeted areas. So there are two types of shock waves, which is the first one is a radial shock wave and the second one is a focused shock wave. Radial shock waves are generated by a projectile fired at speed inside a handheld applicator. So as we can see in this video, projectile is accelerated by compressed air and it strikes the applicator head that is in contact with the area to be treated. Kinetic energy of the projectile is converted into high energy acoustic pressure wave. So this pressure or wave exerts a mechanical stress on cells called mechanotransduction. The impulses are delivered as a shock wave that penetrates the affected area as an aspherical radial wave through a ultrasound gel. And as for focused shock wave, it is generated electromagnetically through a cylindrical coil, creating opposing magnetic fields when the current is applied in a handheld applicator. The shock wave causes a submerged membrane to move and generate a pressure wave in the surrounding fluid medium. The waves propagate through the medium to a focus zone of the affected area. So focused shock waves are able to penetrate more deeply into tissues compared to radial shock waves and are more effective in treating deeper seated injuries. So the applications of shockwave therapy in sport rehabilitation involve two categories, which is injury recovery and injury prevention. So for injury recovery, shockwave therapy is mainly used for pain relief, tissue regeneration, breakdown calcifications, angiogenesis, and increased blood circulation. All this is to just speed up the injury recovery process. So for injury prevention, shockwave therapy can be used to reduce the tissue tension, improve muscle flexibility, breaks down micro tears, also known as regeneration, or produce the collagen. So this to strengthen the muscle, to reduce the tension, to reduce the tightness of the muscle, so the chances to get injury is reduced. This is a case study by Angelo from 2011, which involved 40 professional athletes with chronic proximal hamstring tendinopathy. So they are separated into two groups, 20 each randomly. And the first group, group shockwave, received 4 radial shockwave therapy sessions. Each was performed at weekly intervals with 2,500 shocks per session at a pressure of 4 bar with a frequency of 10 shocks per second. And the second group, the conservative group, received an ultrasound for the first 2 weeks and a massage 3 days a week. So the pain rating of the shockwave group reduced from 5/10 to 2/10, whereas the conservative group increased from 5/10 to 6/10. So the author concluded that the shockwave therapy is a safe and more effective treatment for patients with chronic proximal hamstring tendinopathy. The advantages of shockwave therapy is accelerate tissue healing and regeneration, pain reduction, non-invasive. It is non-invasive and time efficient, and it helps improve overall function outcomes. But the limitations it is inconsistent. It has a very inconsistent evidence, technique sensitivity, and it is cost and accessibility. So for the potential of shockwave therapy is we can try to improve its technology such as ultrasound guided and AI assisted systems. This can improve the accuracy of treatment by ensuring the energy is delivered to the exact injury site. This could make outcomes more consistent and reduce unwanted side effects. Second is we can try to combine this therapy with regenerative techniques like PRP or stem cell therapy. And early studies suggest that combining these approaches may accelerate tissue healing and improve recovery in chronic conditions such as tendinopathy and OA, which is osteoarthritis. Next, we can explore this therapy in neurological rehabilitation, which it helps in expanding shockwave therapy beyond traditional sports and musculoskeletal use. And the last one is we can try to develop standardized treatment guidelines and maybe a portable device, which helps to make this therapy more widely available in community and sports settings. This would allow clinicians and athletes to benefit from the therapy's non-invasive nature more easily. Okay, so this is the radial shockwave therapy machine. This is the handheld applicator. Firstly, we will go to the menu and then select the injury that we want to treat. So in this condition, we are selecting the patella tendinopathy. After that, we can set the pressure bar. So for this patient, we will be using 2.0 and the shocks will be 1,000 for her condition. Before we start applying the shock wave, we will begin to apply a layer of ultrasound gel on the targeted area, so the patella tendon, and we will spread it out evenly with the applicator head. Then press the button on the applicator and start applying slight pressure on the injured area and move around slowly. When the machine stops, wipe off the gel on the head of the applicator, and after that wipe off the gel on the patient's leg.